Assalamu alaikum. The clinical day. Link clinical consultation. 24 years old female, Mrs. Samia, has abdominal pain. All vitals are normal. Please take history, examine her, and address her concerns.
Hello,
Hello.
I am Dr. Salah. I'm the doctor of the clinic today. May I confirm that you are Mrs. Samia, 24 years old?
Yes, doctor, I'm Samia.
Nice to meet you, Ms. Samia.
Thank
I will be discuss your health condition. I will be answering your concerns as well and examining you.
Okay, doctor, thank you.
Can you tell me, Mrs. Samia, more about your complaint, please?
Yes, doctor, my complaint is I have tummy pain since 2 days. Since it started, it is worsening. Today I can't to read this pain, doctor. I tried many painkiller, but it not work with me.
I'm sorry for that, Mrs. Samia. Do you want
Thank you,
do you want to take any medicine right now? I give you any painkiller?
thank you, doctor. I taken it since 1 hour.
Okay, Ms. Samia. Can you tell me exactly where is the pain?
Yes, doctor, I think it is in my lower tummy. I think it is in the right lower and in lower middle, my tummy.
Okay, Mrs. Samia. You say it is started from 2 days.
Yes.
It was the same. It's you say it's worsening.
Yes, doctor, it is worsening a
Not
lot.
going. Yeah, not going off on continuous.
No, it is continuous, doctor. Yes. It is
Can you
worsening.
scale? Yeah, can you scale the pain?
Yes, doctor.
Can you
Since
scale the pain,
started,
Mrs.?
yes, since it started 2 days, it was 3 or 4. Now it is, I think it is about 8, 7 or 8. Yes.
Again, Mrs. Samia, please.
Since it started, this pain since 2 days, it was about 3 or 4. Now it is 8.
Yes, I'm sorry for that, Mrs. Samia. You feel it is like radiating to going or transferring to anywhere else other than your lower tummy?
No, doctor, I don't think so.
You know where exactly? You can point it?
Yes, it is in my in the right, in the lower tummy.
Okay, Miss.
Yes, in the yes, around the umbilicus and right to umbilicus.
Yes, I'm sorry for that, Mrs. Samia. Can you tell me if there is any symptoms, any problems you feel with the pain, like any loose motion, any sweating, any fever?
No, doctor. No, I didn't have any fever. Nothing. Yes.
Only the pain, Mrs. Samia?
Yes, doctor. The severe pain.
Okay. Did you? Can you tell me, Ms. Samia, if you have any past medical history?
No, doctor. I don't. I didn't have any past medical history.
Okay. No medication you are on?
No, doctor. No, no.
Okay. You didn't have any surgery before or any?
No. No, doctor.
You don't have any allergy?
Never.
Or any admissions?
No, never.
Okay. From the vitals all are normal, right?
Yes. Yes, doctor.
Can you tell me if there is any weight loss or loss of appetite?
No, doctor.
In these 2 days?
No. It's just 2 days, so I can't notice that.
Yes. Any lumps or bumps in your body?
No, doctor.
Okay. Can you tell me, Mrs. Samia, if you have any you say there is no loose motion, right? You don't have any heartburn or like burning sensation
No,
in your
doctor.
tummy?
No, doctor. No.
No change in the bowel work, right?
And the bowel, no.
No. You didn't have this pain before? This is the first time to feel same pain?
Yes, doctor. This is the first time.
Okay. Can you tell me, Ms. Samia, if you have any family history? Any?
No, doctor. No. Just that my father is hypertensive. Just that.
Okay. Okay. Miss Samia, can you tell me if you have any headache,
No headache, no doctor.
any loss of consciousness?
No,
Nothing happened through this 2 days? Any
never,
weakness
doctor.
anywhere in your body?
No, no, doctor. No.
Okay. Can you tell me if you have any racing of heartbeats?
Racing heart, no.
Shortness of breath?
No.
Okay. Any coughing?
No cough, no, doctor.
Any cough of blood?
No.
Okay. Can you tell me if you have any like tummy swelling or distension, discomfort?
No, doctor. No.
No.
My tummy.
No feeling sick
No,
with the
doctor.
pain?
No, doctor. Other than the pain, no other thing.
Okay. Can you tell me, Mrs. Samia, if there is any recent travel history?
Travel, no. No, doctor.
Okay. Any weather preference in
No.
before?
No, doctor.
Okay. Any sharing needles or I'm sorry for that question. Any sharing needles or illicit drugs?
No.
No.
Yes.
Okay, Mrs. Samia, can you tell me about your last period, please?
Last week, it was since 2 months.
2 months. Okay.
Yes.
It was regular before?
Yes, doctor. I think it
Is
was
it,
regular. I
is
just
there any?
Yes, doctor. I just married since 2 months. Since married, I have no period.
Okay. And before the marriage, you have a regular period, right?
Yes, doctor. It was regular. Yes.
You are not on any pills?
No, doctor. No.
Okay. Can you tell me, is there any chance you are pregnant right now?
I don't know, doctor. Really.
Okay. Do you have any abnormal bleeding or something?
Abnormal bleeding? No. Abnormal bleeding?
Or spotting?
No, doctor. No. No.
Okay. I'm sorry for asking this question. Is there any other relationship other the marriage? Any casual
No, doctor.
relationship?
Never, doctor. No.
Oh, I'm sorry for that, Miss. I'm sorry for that question, Mrs. Samia.
Thank you, doctor.
Can you tell me, is there any what do you do for a living, Miss Samia?
I'm a housewife, doctor. I didn't work anything.
Yeah, I'm sorry. Okay.
Yes.
Okay, Mrs. Samia. Can I examine you?
Sure, doctor.
Okay. Miss Samia, I will take a look for the general
It is
appearance.
normal?
Is it
Yes, it is normal appearance.
no rash? I
No.
didn't ask you about the joint pain or any rash in before, Mrs. Samia. You
No,
don't have
doctor.
any joint pain?
No joint pain, no rash, doctor.
No rash? Any weather
Yes.
preference?
No.
No? Okay. Okay, general look is good, is normal, right?
Yes. Normal.
Okay, I will ask to see the hands. Is there any change in the hand?
Like what?
What?
Like what? In the hand. Okay,
I
it is normal,
didn't hear
doctor.
you.
Yes, it is normal. Okay.
Okay. No, like what? Oh, okay. Is there any skin changes, any clubbing, any
No.
hemorrhage, any erythema?
No,
No?
doctor, it is normal.
No.
Yes, normal.
Uh, okay. I will see the pulse. Pulse is normal,
But it is normal, yes.
regular.
Yes, all vital signs normal.
Okay. Okay. The neck, is there any JVP?
GB, no, doctor.
Normal.
Normal, yes.
Okay. No lymph nodes, nothing. I will see the face.
No need, doctor, lymph node. No need to examine the
Okay.
lymph node.
Okay. I will see the face. Any eye pallor or jaundice?
No, normal.
Any skin change in the face?
No, doctor.
Any
Normal.
mouth change? Any cyanosis?
No, normal, doctor.
Okay. Okay. I will examine the chest and the heart for any murmur. The heart first. I localize the apex in its place.
Okay, doctor, no need to examine the heart.
No need.
Yes.
Okay. And the chest is normal, no
Yes,
crepitation,
chest
nothing.
is normal, doctor, yes.
Okay. The abdomen. Okay. I will try to
Abdomen
examine
is
the
tender.
abdomen.
Please be gentle
Tender
with
from
here.
the, okay,
The lower, yes,
okay,
yeah. Mhm.
the lower part, but I can no touch
No
at all,
superficial palpation.
or
Superficial
superficial
palpation,
only?
normal. Normal, yes.
Okay, okay, but the deep palpation she cannot tolerate.
Yes, can tolerate.
Okay, only from the right side.
Yes, doctor.
No
The
organomegaly, no splenomegaly, no hepatomegaly.
no organomegaly. Mhm.
Okay. Okay, Miss. Okay, Miss. Mrs.
Samia?
Samia.
Mhm.
What is your concern?
Okay, doctor, you have 5 minutes.
5 minutes, Samia.
Okay.
Nothing in my mind right now.
Yes.
My first long case.
What? Yes. Okay, no problem, no problem. You did great, really. But water work.
Okay. Oh,
Yes.
okay. Any change in your water work, Mrs. Samia?
Water work. Like what, doctor?
Any frothing? Any burning sensation?
Yes, doctor. I think since a long time I have burning sensation in my urine. But I seek medical advice, give me some medication, and keep me on waters. So it improved a lot.
So you had okay. Now
Yes,
you are improved. You don't have problem with the water work right now.
Right now, no, doctor.
You're relieved. Okay. Can you tell me the medicine you take?
I didn't remember, doctor. It is a long time. Since a long
A
time.
long time before the marriage,
Yes, before the marriage.
you had this infection, this problem in your urine before, or it was your first time,
No,
or before it happened?
it's since a long time, since I think 10 years. I have burning sensation because I didn't drink water a lot. So my doctor advised me to drink water. Just
Okay.
that.
It only happened for one time or recurrent?
No, it is recurrent.
Recurrent.
Yes.
Okay. Okay, Mr. I will check for the kidneys. Are they
No need, doctor. No need, doctor.
no need? Okay.
Yes.
Okay, Mrs.
So,
Okay, Mrs. Sam. What's your concern?
yes, doctor, what I have.
Mrs. Samia, after asking you the question and examining you, it's not sure the diagnosis right now, but it is more than one possibility. Okay. Maybe because the infections you had in the past, maybe they affecting your water work system, okay, which make this inflammation. This is a possibility, and I'm not sure about that, but we will make, I will be referring you to the group of doctor, urology doctor, which responsible for the water pathways, and also for the woman doctor, and a specialized nurse to confirm, to form a team which will make more investigation for you, more blood test for you, and imaging to know exactly what are you
2 minutes
having.
left.
Okay. Another possibility, Mrs. Samia, that maybe there is because you have no period for 2 months, maybe there is a pregnancy, but we have to confirm that with a blood test and more imaging. This will be done by the woman doctor also. Do you have any other concern?
So it is pregnancy. It is good news for me, doctor. Really.
I'm not sure. I'm not sure, Mrs. Samia. We will see, and we will confirm if there is a baby or no.
Oh, it is not concerning me, doctor, about the pregnancy or have baby. Okay, doctor, thank you very much. Thank you. Doctor, do you admit me in the hospital?
Yes, Mrs. Samia, I will be admitting you because this is severe pain. We have to give you some fluids and painkillers, and to see exactly if there is any urgent problem, we will solve it with the team.
Thank
Is
you
it
very much.
okay, Mrs. Samia? Are you okay?
Yes, doctor. Sure, doctor. Yes.
Okay.
Thank you.
Okay.
Thank
Are you satisfied with the history, Dr. Makina? You want to ask more? Any question
you.
else you want to add? Any advice you want to add?
But I asked about the post-medical history, but
Okay,
there
forget
was
about
nothing in the
it.
post-medical
Yes.
history.
Social, you ask about social, smoking, alcohol, job.
Smoking and alcohol, no.
Okay, now you remember
Okay.
it. Any
Okay.
positive you want to know?
For the recurrent UTI, it was always solved by the antibiotic. Nothing.
Okay,
It
let's
was just
start examining.
hydration. Okay, the
Let's
examiner.
start examining the question.
Okay,
Okay.
doctor, give me your differential diagnosis, please. The most appropriate differential diagnosis for this patient. The most appropriate diagnosis. Okay.
In my mind, also, in spite of this old UTI, the first is maybe pregnancy and
Remember the side of the pain, right side. Okay, remember it. You can give good
okay.
differential.
Okay. Okay, my first differential in my mind was appendicitis. Okay, but
Very good, doctor.
against that, she had no
Yes.
fever. She had
Yes.
no feeling sick. She,
Very good.
I didn't examine this psoas muscle and this. I didn't know. I didn't examine well, but because maybe it's tender. But this is the first one. Second one, maybe like in-tube pregnancy, something like that. Like
Okay. What's the name of
yeah,
NTU
I don't know. I don't remember the name.
Okay.
Like
Ectopic.
Ectopic pregnancy.
ectopic, yes,
Yes.
ectopic, yes.
Mhm.
Ectopic pregnancy. The second, maybe recurrent UTI, but against that also there is no frothy urine, no any signs of inflammation
Very good.
with examination,
No fever. Yes.
and no fever.
Okay.
Vitals are okay.
Okay, doctor. What else?
What else? Pelvic inflammatory disease.
Yes, very good.
This is the right, so we cannot say like diverticulitis more on the left.
Okay.
Only like that. Nothing else for the differentials.
Okay. Did you ask the patient what is the character of the pain? Is dull aching or stabbing or throbbing?
No.
Mhm.
No.
Okay.
Mhm.
Okay, doctor. Okay, what
Characters.
will the character? Yes. What will you do to this patient? What will you do?
I will admit the patient. Okay.
Good. Okay.
I will give her fluids. Okay, and painkillers.
Okay.
And then we will do the basic investigations from the full profile, liver, kidney, renal, and the CBC to know if there is any infection. Also, we will see inflammatory markers. We will do ultrasound and CT for if there is appendicitis or something.
Okay. What about
We can.
Mhm.
What about?
What is the ectopic pregnancy? What will you do to this?
This I will be referring her, of course, to the gynecology doctor.
Yes.
Okay. And also for the urology doctor, I will be involved, the multidisciplinary team. Urology doctor and gynecology doctor will be with them. And that's it. Okay.
What is the specific to ectopic pregnancy to be?
Beta HCG in the
Yes,
blood.
very good. Yes, doctor. And you said urine analysis and urine culture?
Urine analysis, okay, urine culture.
And urine culture.
Urine, maybe, I'm not sure, but we can make also the routine, and it will be albumin and everything in the urine. And imaging, we can make like X-ray if there is any right maybe stone. Is there in the differential? Maybe urinary stone in the ureter.
So you tell the patient you will admit here in the hospital. Why admit the patient? Do you fear from anything happen to the patient?
I'm afraid from this this ectopic abortion.
Yes.
Which will be I'm not sure from the name, but this ectopic pregnancy is very dangerous, and it can affect her life. So if there is ectopic pregnancy, I have to know. Also, if there is appendicitis, I'm afraid from rupture. So I have to manage early as possible.
Do you know how to know that the tube is ruptured or not? Now the patient has ectopic pregnancy. How do you know that? How do you know that the tube is ruptured or not? Any signs in the patient, or the pain will be referred any other side?
Maybe in the back.
No, the pain will refer to the shoulder.
This is very new for me.
To the shoulder.
This is very new case.
Okay. Yes, doctor, but
Okay.
thank you, Dr. Bakinam. You did it very good. MashaAllah. Really, very good. Very good.
Thank you, Dr.
You
Mohammed.
really very good. You started from analysis of the pain, the site, and radiation, and timing, and the scales. You offer me painkiller, but you forget the most important thing, the pain in the lower tummy. So you didn't tell anything about the water work.
Yeah.
Yes, we put the water work burning like UTI يعني to mislead you from the ectopic pregnancy. So the examiner will ask you the official diagnosis. The first will be ectopic pregnancy because the pain is stabbing now. Stabbing pain starts since 2 days. If you ask me what is the character of the pain, I will tell you the pain started as dull aching. Now the pain is like stabbing or sharp ache. So it is in the tube. So the first diagnosis will be ectopic pregnancy, second appendicitis, and third recurrent UTI. This is the most appropriate 3 official diagnosis. After that, renal colic, anything, no problem. But the first is ectopic pregnancy. Pain is 8. Pain scale is 8. You forget. Mrs. Samia
Smoking alcohol.
was not smoking alcohol, but believe me, in the exam, they will deduct from you. Even I'm not smoker, I'm not alcoholic, they will deduct from you.
Yes.
And the يعني nominate the most appropriate official diagnosis from the most potent to the least potent. Like ectopic is the most potent. If you tell the examiner first recurrent UTI and then appendicitis, he will deduct from you. Believe me.
Yes, doctor.
Okay.
First, from you said that she's
No,
okay. I just married 2 months and I have no period.
Yes.
I thought it's pregnant.
It is the key. It is the key. The key in this case.
Yes.
So,
but when you ask me, you didn't ask about the water work.
Yes, because
I got
you must put
distracted again.
Yes, because in my differential diagnosis, as examiner, recurrent UTI in my differential diagnosis. But apart from that, no fever, no flu urine, but maybe recurrent UTI without fever. What is the problem?
Yes, it can. Right.
And the examiner will ask you, what do you think about maybe UTI? He wait you in the examination. He wait you. Okay, that's my comment, Dr. Press.
Thank you, Dr. Mahmoud.
Yeah, thank you, Dr. Mahmoud. Very nice case and easy and simple. Dr. Bakinam did it perfect, but I will repeat, Dr. Bakinam, how to do it in a perfect way, okay?
Okay.
So you started the analysis of the complaint well, which is onset course duration, after confirming the
Mm.
patient name and that. You did this
Yes.
perfectly. The next thing, the site of the pain, radiation, the scale of the pain. Also, you did this. Okay.
Okay.
The next thing to do, analysis of the relevant system. What do you think the relevant system here?
Tummy, abdomen.
Exactly. So
يعني
what question for the GI?
mm,
Exactly. the GI question. What do
mm,
you think? Do you feel sick? Do you have any difficulty swallowing? You have any tummy discomfort, this tummy pain, the change of your
yes.
bowel habit?
Mhm.
You postpone this question, but you can ask this question now. Why? Because it's relevant system. As I prefer to ask about relevant system and the same time of analysis of the complaint. After that, as you did exactly past medical history, you didn't find anything, which is great. You ask about
Mm.
surgery, allergy, admissions, procedure. All the things also make sense. Then now the time for constitutional. You ask them any fever, loss of weight, loss of appetite, night sweat, lumps or bumps. This is for serious infection or malignancy. Even inflammatory bowel disease, it can be there. If you ask these questions and you found there is any positive data from this, either loss of weight, loss of appetite, you can add one question here
But
to
2 days خلاني ما يعني
Yes, exactly. I know.
mm,
I'm just putting some serious conditions you could put in your mind while you have abdominal pain.
yes.
Okay. If
Mhm.
the good thing also you ask later on, although you forget, but you will remember later any previous attack, or this is the first time ever.
Yes, this very
Yeah,
important.
very important
Yes,
question. Why?
yes,
There is differential, big differential about
Familial Mediterranean fever.
exactly recurrent abdominal pain.
Mm.
And this question, if you don't ask this question, believe me, you will lose the case. Why? It might be recurrent abdominal pain, and you'll just give ectopic pregnancy, and as you did here, and the case will be recurrent as acute intermittent porphyria or FMF, familial Mediterranean fever. So
Yes.
you might lose the case if you didn't ask this question particularly, but you ask it.
Mm.
Okay, the next thing, system review from the head till the toe. But I don't know why you missed the urinary, which is very important system here.
Every
Remember,
trial I miss something. It's not fixed.
that's why we are practicing. Okay, that's why we are
Yes.
practicing. With every time, you will not forget next time. Okay,
Yes.
let's assume you have a look to the patient. You will remember from the head, the neck, the chest, the abdomen, the pelvis, and lastly the extremities. And add to the extremities skin rash and joint pain. If you do this in the same manner, you will never forget any system. Okay, remember the patient or
Mm.
imagine the patient in front of you from the head down to the toe, system by system, from up downward. The system you already analyzed, no need to repeat it unless you have something remembered in your mind. For example, in this scenario, you will not ask about any blood in your back passage initially. But later on,
Mm.
if you remember that I should ask about any passing of blood in the back passage, you
Yes.
can ask it. Why? I
Mm.
should roll out something
Mm.
local or something related.
I like interception حاجات.
Sorry, like what?
Any يعني acute abdomen case interception, obstruction,
Can be.
any
Yes, can
mm,
be. Yes, you're right.
mm,
So put this in your mind. Then the urinary is very important. A lot of anatomies and organs passing in this area. The ureter, one of the important differential here, ureteric stone, ureteric obstruction, for stone also, gravels, UTI, ascending urethritis. So put in your mind this system in the GI or the abdominal pain differential. Don't miss it again. I think this case,
mhm.
the practice today, will remind you with the next time. Then
Yes,
you can
very good
ask
case.
again, yeah, the social. as you ask, family history of same condition, any family history you can add here, but it's not as acute because the cancer colon will be presented with long time, so you cannot ask this question. But you can ask about any family condition of the same condition, if any family history of same condition. This is for family travel. Important to ask about travel. If you have any travel history recently, what you will ask in this scenario?
What was the question?
You have positive travel history. What question you could add?
Did you take your vaccination? Where do you go?
Exactly.
Uh,
Plus something related to
uh,
GI, particularly if
uh,
she has diarrhea.
ما هو there is no diarrhea. That's why I
I-
didn't. Yeah,
It might
if she
be
had diarrhea,
another
yes, that's
case.
why.
I mean, it's not in this case. In
Yeah.
another case,
Yes.
patient with abdominal pain, you found diarrhea, you found travel history. What question you could add?
Is it bloody or not bloody?
No, related to the
Check.
travel and the case. Travel and the case.
Travel and
Diarrhea
what?
and the diarrhea.
Ah, okay.
What you will ask, particularly for the travel history related to the diarrhea. If you have abdominal pain with
What did you
diarrhea.
eat? What did you
Exactly.
eat there?
Yes. Yes.
Yes.
What did
Okay.
you eat? Is it
Mm-hmm. From
street
the
food
restaurant or
or
from the
yes,
like
restaurant? Exactly.
local
Anyone
foods.
in your journey, anyone has the same symptoms as food poisoning?
Mm-hmm.
So you have to ask
Yes.
this
Yes.
question if you have such condition. But I'm trying to open your mind to the other
Yes. Yeah.
differential and other cases, but it's not the case here. Finish travel,
Okay.
finish family. Yeah, don't forget the female history. Good, you remembered during asking the system review. Usually after the
Yes.
urinary or while taking the urinary or the system review. If you forget it earlier in the system review, you can add it through the HIV question. You have partner?
Mm-hmm.
Yes, I have partner, doctor. Sorry for
Mm-hmm.
this question. You have any casual relationships? No, doctor. Now you can ask about female history. You can
Mm-hmm.
ask about any about how about your period. How is are you pregnant by any chance? As you ask exactly, period, pregnancy, OCPs, any birth control pills.
Mm-hmm.
Okay. What if you have patient with birth control pills with severe abdominal pain? What you suspect? What you can think about? Severe abdominal pain, OCP,
Mm-hmm. Okay, maybe
history of
like
blood clot.
clot يعني
Yes,
APLS
exactly.
والحاجات دي. Mhm.
Exactly. Mesenteric
Yes.
ischemia. Yes,
Mesenteric
you
ischemia.
can.
Yes, this also
Yes.
when there is bloody diarrhea or blood in stool. It can
Bloody
cause
diarrhea,
by
AF,
mesenteric ischemia. Mm.
ischemia. Perfect.
Mm.
You might have also AF, but the patient usually
Yes.
will be either older than this or she will have another comorbidity like AF, like dyslipidemia, like
Mhm.
antiphospholipid antibody syndrome. So
Yes.
think like that, okay? I want to make just differential for other possible other presentations, not this case, okay?
Yes.
Then the HIV, you can ask quickly in sharing needles, tattooing, piercing. Here, it's not because the patient presented acutely, so it's not making sense to ask all this question. However, you can ask them quickly, briefly also, if you have time. The last thing,
Mhm.
always remember the do you together. Do you package? Do you smoke? Do you drink alcohol? Do you drive? What's your job?
Yes.
Don't ask one
Mhm.
question and forgetting the others. You ask for the job, right?
Yes.
But you
She's
didn't ask
housewife.
about the impact on her job.
Yeah,
On her
because
job.
she's housewife. If she was working.
Even
Yes.
sometimes,
Daily
Yes.
activity. Yes.
yes,
Yes.
sometimes
Right.
even the
Right.
acute pain will limit her activity at home. She cannot
Yes.
cook for her babies. She will tell you, I cannot even stand up, doctor, because of this pain.
Right.
Okay, so it's important to ask this question. What the impact on your daily activity? I am really feeling sick, doctor. I cannot tolerate. So offer some help, some social support, some uh, any kind of support she might need, plus the admission, of course. And
Right.
the good thing here, whenever you find a scale of pain more than 5, yes, you can
You have
admit the
to admit.
patient safely.
Mhm.
Okay. Do you smoke? Do you drink alcohol? It's important, of course. For any reason, as Dr. Mahmoud said, even if not related to the case, you have to give some advice if she is doing smoking or she is doing
Right.
drinking alcohol.
Mhm.
Sometimes it could be relevant or related, sometimes it's not. But don't forget to ask about it or about them. Driving here is not important at all because she's presented acutely, so even she cannot. I mean, she can be able to drive even with the abdominal pain. She can take some painkiller and she can do driving. So don't
Mhm.
ask this question. Then the examination, you did the examination step perfectly. Started from the hand, the face, and the eye. Don't forget the eye always for the pallor and jaundice. The mouth for
Yes.
any mouth sores and
Mhm.
any mouth ulcers.
Mhm.
What do you think the mouth sores important in abdominal pain patient?
Crohn's, ulcerative colitis.
Perfect. Yes, perfect.
Mhm.
Not in this
Mhm.
case, but I mean in
Yes.
other
General.
case, yes, generally. Mouth sores is important to examine if you suspect celiac or Crohn's disease.
Right.
Remember them or
Mhm.
Behçet. Behçet as well.
Yes. Or Behçet. But Behçet, it can come with abdominal pain.
Yes, of course.
Yes.
Behçet, by the way, it can present as thromboembolic or thrombophlebitis and thrombotic condition. It
Mhm.
can present with diarrhea, with abdominal pain, with the genital ulcer, with mouth ulcer, DVT, PE. So it's a good high yield topic. The Behçet, by
Yes.
the way, in the exam. Okay, it might present
If,
with all these things.
Mhm. Doctor, if I didn't know the first differential, like ectopic pregnancy, or I didn't come into my mind, I would be losing
At
the
least
station
if you put it secondly, you will get the good mark or maybe full mark.
if I didn't put in my mind at all. If I didn't
No,
say,
you'll remember it. You will remember it because you ask about pregnancy by name, and at the end you will put it as a differential. And after
but
this
if
case,
I
also
miss
you
that
can.
first differential, generally, if I miss the
Yes,
first differential,
yes,
I
they
will
will
be
minus
lost.
you.
I
They
will
will
be
minus
losing the
you.
case. Wala.
They will minus unless you did good examination, good approach. They will give you at least half the mark. Half the mark.
Mhm.
14 out of 28, which is not bad if you lost the whole case. But I think the examination step you can remember by them because this is female and the childbearing period. Believe me, you can put the differential and you will not forget it. Okay, but the urinary is very important
Yes,
here as a
this is
differential.
kill
So
it.
the three differential, yes, I think you will
Yes.
not forget this
Mhm.
case again. As a differential, ectopic
Yes.
pregnancy,
Um,
acute appendicitis. That's why I stressed on the right side. Remember the side and the area of the pain. You can put differential only related to the eye, the area or the site of the pain. According to the site, you can give good differential if you remember. Okay, don't just give any abdominal pain differential. It
yes.
should make sense for for the examiner that it is related to the anatomical organs here
Mhm.
or anatomical part of the organ here. That's why
Okay.
appendicitis, yes, it's one of acute abdominal pain presentation,
Mhm.
even if no fever. It doesn't matter.
Mhm.
Yes, usually there is fever,
Not
but
all
it's
patient come with fever.
exactly.
Right.
She might take some an antibiotic and the fever will
Mhm.
disappear. But it's still one of the, and you have to do the rebound test here. You
Yes,
know,
I
you know
didn't.
how, right?
But here,
Yeah.
this patient, she was already in pain and tender
Yeah, at
abdomen.
least offer
How
it.
I will
Offer
be?
it.
Okay,
Why? I want to rule out appendicitis.
right. Mhm.
Okay.
Okay. Is there
Uh,
any investigation I didn't say? Mm.
no, I prefer to say beta HCG for the patient from the first presentation. Even you can ask for the test.
To exclude any pregnancy, even not
Yes,
ectopic.
yes,
Mhm.
yes. Patient present with abdominal pain and lost a period for 2 months or 2 weeks. Anyway,
Y- Um,
2 months,
2 months.
anyway,
Dr. Bassem.
two
Yes.
months. Yeah, so pregnancy on the top. No need to call for gynecological to check for pregnancy. You can send the test. If the test is positive, HCG high or significantly high, You can call the obstetric or
Yes,
gynae doctor.
I think the question was how to deal with ectopic pregnancy. That's why I
Yeah,
need
I
now
should
the.
I should first diagnose the pregnancy by beta ECG.
Mm.
I will not do anything. Just
Yeah.
diagnose.
Yes.
First, this is by the way one of the basic tests for any female in the childbearing
Female.
period with
Right.
abdominal pain. They are doing
Mm-hmm.
this test in the emergency without even calling the IM doctor, internal medicine. They can do the tests immediately from the blood as a beta ECG pregnancy test. Why?
Yes.
Because I should know. Even for the safety, I should do this test. If I am going to do chest X-ray or any X-ray, I should be safe while requesting this image. Why? If this patient is pregnant and I requested unnecessary X-ray, either abdomen or chest, it might harm the baby, right? So
Yes.
I should do this test in any female coming to the emergency in the childbearing period with abdominal pain with missed periods.
Mm-hmm.
Clear?
Yes.
I think other question and examination steps you did great. The lymph node very important to rule out any infection. You can offer inguinal lymph node also examination. The kidneys, don't forget to palpate the kidneys for hydronephrosis if you suspect urinary stone or
Mm.
ascending pyelonephritis, or but it's not the case. Pyelonephritis, the pain will be at the flank rather than in the right iliac fossa.
Yes.
Okay. Any question,
Okay.
Dr. Fabakinam, for this case?
Thank you, doctor. Thank you, Dr. Mahmoud. Thank you, Dr. Basim.
Most welcome. Any comment, Dr. Mahmoud, or any question you want to add?
Thank you, Dr. Bassem. Thank you very much.
Okay. Any question from others? Any comment about performance? Any comment about the differential, the topic itself?
Mm. No, doctor, but they are asking it is not coming in MRCGP or what? MRCP.
I will comment on this. Nowadays, the topics are varied. They can ask anything, they can present patient with any presentation. Be ready. Even with the normal pregnancy, you can put it in the differential rather than ectopic. But ectopic here makes sense because the pain is localized. What I mean, anything in the exam can present. So don't say, no, it is difficult. Yeah, it's rare to be presented, but it might come. Don't be strict with the cases we are practicing as usual. You have to do the common case, yes, of course, but the less common case, try to do them even once. Dr. Bakinam, lucky today to do acute abdomen. As acute abdomen, even the cause is different. So they brought the recurrent abdominal pain as FMF, DKA, acute intermittent porphyria. Now she practice new topic, acute abdominal pain, which is acutely and first presentation. She opened her mind about the other differential for the acute abdominal pain. Yeah, it's not common, but it might come. Okay, be ready for any scenario in the exam. But Kayari,
Yes.
but Kayari, yes, for Behzad, thank you for adding this. So, but Kayari can be presented as
Yeah, because
presentation of
clothing.
perfect clotting, but the patient will be presented with jaundice, ascites, abdominal pain, the triad of bad Kayari. So
Mhm.
I think Dr. Ipon, I don't know the name, but he want to make the other possibilities of the presentation of Behzad. Thank you for adding this. Eat from outside, yes, perfect. Nutritional history. Dr. Bakinam, give Dr. Mahmoud the case until I read the scenarios. Someone, Dr. Muzharul Islam. It's came in MRCP. Really thought what left for MRCO. Okay. Why not? It's pain. Still, you are thinking about the medical causes before thinking about the surgical or obstetric. Even if you diagnose, you can refer to the patient, but still you can roll a simple UTI. The patient has history of UTI or renal colic, ureteric stone. So it open your mind. There is a lot of differential differential before referring the patient to. Okay, what if you refer this patient without, for example, missed period? You refer the patient to gynae or obstetric. What do you think? What they will tell about you if you refer this patient without a history of missed period, but you suspect it? How and why you suspect it? You are not prepared, for example, to this case to be faced by you, and by the chance you found this case, and you said, "Oh, maybe ectopic pregnancy. I will refer to the obstetric." What do you think he will do? And the case will be like UTI only, simple UTI, but you refer him because you heard there is a missed period, for example, or missed period, or patient had got married recently, or whatever. So please do your work and make the things clear for yourself before referring. And this is your job also to get at least good differential diagnosis before referring the patient. Nutritional history, yes, it comes like, okay, we finished this topic. Can question about ectopic pregnancy be asked in internal medicine? Only the question will be how to test for ectopic pregnancy. And just pregnancy test is enough. And ultrasound, you can refer the patient to radiology to do ultrasound. After that, you can refer the patient to the gynecologist. Ectopic pregnancy, okay, ectopic pregnancy, MRCPI. Usage of uterus. By the way, there was a case of uh, what's called IUD, right? IUD? Oh no, pelvic inflammatory disease, PID, sorry, PID, pelvic inflammatory disease. Maybe because of a missed loop intrauterine device. So be ready to put this differential in your mind. Why not? Dr. Bakinam, you wrote the case?
I guess. I'm not sure Dr. Mahmoud only can see it or both or all.
No
Yes,
one can.
yes, I see Miss Mona, 34 years old, came with leg swelling for 2
Where
days.
did you write it, Doctor? Where?
In
Chat box.
the chat, but
Oh, so
related
sorry.
to Dr.
They send it private. Okay.
Yes, but I didn't
Private?
know how to.
Okay, make
You
copy,
can
Dr.
share it.
Mahmoud, and share it
Yes.
to
You can
all.
share it,
Yes.
Mahmoud, because I'm not sure how
Okay.
to.
Okay.
Now we can see the Miss Mona, 34 years
Mm.
old, came with leg swelling for 2 days. Perfect. So we have another acute presentation. Patient with acute presentation. Dr. Mahmoud, if you're ready, let me know. Please, everyone, he can put some differential how to approach this case. It's common scenario in the basis, swelling in the leg as acute presentation in young female. Everyone put his differential in a paper, and later on, the one who put it as a first differential, please let me know. He might get a gift, practicing 1 day free. No, don't write in the chat box. Put it in your paper and give me 3 differential. Could be the case at the end, not now. The one who put 3 differential related to the case and might be correct, he will be the winner for this session. No problem, Dr. Nada. It's not necessary to be DVT. It might be another case. When you read, Dr. Mahmoud, let me know.
Okay, Dr. Bassel, please. So we will see. person?
Yeah, ready?
Really?
Okay, here you go.
Good evening. I'm Dr. Musa, doctor in the clinic today. Let me confirm you are Mrs. Mona, 34 years old.
Yes, right, doctor.
Ms. Mona,
am.
we okay. Ms. Mona, we are here to discuss about your recent complaint. Is it okay with you?
Yes, doctor.
Okay, Ms. Mona, before we start, can you tell me more about your complaint, please?
Right, doctor. I have this pain and swelling in my leg. Very severe. Uh, very aching, doctor. I cannot bear the pain.
I'm very sorry.
Just for 2 days, doctor.
Okay, Ms. Mona, I'm very sorry to hear about that. And I'm sorry for your suffering. Sorry, Ms. Mona, when it started exactly? Since 2 days, yes?
Yes, doctor.
Okay, it's the first time you have this swelling or any previous attacks?
Yes, doctor, first time.
First time, okay. Till it started, Ms. Mona, since 2 days, it is stationary or worsening?
Yes, doctor, it is worsening. Very, very painful.
I'm sorry for that, Mrs. Mona. Any diurnal variation, Ms. Mona? It is increased in the morning or at the evening?
No, doctor, it is the same.
It is the same. Okay. Is there any pain?
Yes, doctor, there is pain.
Where is the pain exactly?
In the back of my leg.
In the back. Okay. Since when this pain?
What?
Since when? Since 2 days also?
Yes, the same time.
Okay. What is the character of this pain? Sorry, Ms. Mona. Is it aching or stabbing?
Aching, dull aching, doctor.
Okay. Ms. Mona, how much you grade this pain? 1 is minimum and 10 is maximum. So what will you give to this pain?
Doctor, I think it's 8.
8. Okay, I'm very sorry. Do you want any painkiller till now?
Okay, doctor, I took some before.
Okay, sorry for that, Ms. Mona. Sorry, Ms. Mona, what is the level of swelling? It is above the knee or lower the knee?
Yes, doctor, it is to the thigh.
To the thigh. Okay, so Ms. Mona, when you clench this your skin, it is pressing. When you press on the skin, it is blenchable. It is blenched.
It leaves marks, doctor, when I
Leaves
press
mark.
on it. Yes.
Mhm. Okay. Sorry, Ms. Mona, about this pain, this in the back of your thigh, or of your leg. Sorry. It is in the 2 leg or 1 leg?
One leg, my right one.
And the swelling in the 2 leg.
No, on my right arm.
In the right only.
Yes.
So the left is normal.
Yes, doctor.
Okay, Ms. Mona, do you have any other pain in your body?
No, doctor, right now, just my leg is so painful.
I'm very sorry for that, Ms. Mona.
Thank
Ms.
you.
Mona, do you have any fever? Since 2 days?
No, doctor, no, I don't have fever.
Okay. Do you have any lose weight? Weight changes?
Yes, I lost some weight, but not so much.
Since when you lose weight?
Like through the 2 months, like 2 kilos in last 2 months.
Is it intended?
No, doctor, but maybe because because I'm tired. I had this chest infection 1 week ago.
1 week
And,
ago.
yes, and I'm also taking methotrexate for my disease.
Okay, sorry for that. Okay, any night sweat?
No, doctor. No, I don't
No?
have.
Okay.
No,
Any lumps in your body?
no.
Okay. Do you have any long-standing disease should be aware?
Yes, doctor, I have rheumatoid arthritis for 6 years.
Okay, what medication do you take for rheumatoid arthritis?
I take methotrexate and I take painkiller.
Okay, what do you know the names of painkiller? Is paracetamol or
Yes, doctor, just paracetamol.
paracetamol? Okay. Any recent changes in medication in the dose of methotrexate?
No, doctor,
Any other
no
medication?
change.
Any other medication other than methotrexate and the painkiller?
No, I
Any
just
dose?
take folic acid.
Okay. Do you have any joint pain right now?
Yes, doctor, but for now I'm good. I'm stable. No problem.
Okay. Any rash in your body?
Right now, no.
Okay. Do you have any shortness of breath?
No, doctor.
Okay. Any racing heart?
No, doctor.
Any cough?
Look, doctor, I have shortness of breath. Okay.
Okay. Do you have shortness of breath since when?
It is the same, like same time through this week. I
So
have
this
some chest pain, like
chest
small
pain or
pains in my chest, right?
okay, chest pain or shortness of breath?
Or both of them.
Both of them. Okay. Sorry
Mhm.
for that. Okay. Do you have any breathlessness when lying flat?
No,
Any
no,
breathlessness,
doctor.
any breathlessness awake you from sleep, sleep, searching for
No,
the air? Okay.
no.
Okay. Any racing heart?
Yes,
There is a racing heart. Okay. It is regular, like my type, like that, or irregular?
no regular, doctor.
It's regular. Um, sorry, Mrs. Mona. Do you have cough now? Cough?
No.
Okay. Any past history, infection, chest infection?
Yes, doctor. The last week I had this chest infection
Before
and
last
I
week?
took for medication. Yeah.
Okay, you take antibiotic. You take antibiotic.
Yes. Yes.
You,
I
did you
took
seek medical
ceftriaxone.
advice?
Yes. Yes.
Oh, okay. For how long do you take this medication?
Like for 1 week or 10 days.
Okay. What about any tummy pain?
No, doctor.
Okay. What about your water work? Any change? Amount?
No.
Any fluid urine?
No, doctor.
Do you have any bowel changes like loose motion?
No, doctor.
Sorry, Mrs. Mona. Did you anyone did, notice any bowel? Do you have bowels in them before?
Yeah, I have ballot, but always.
Do you have any tiredness nowadays?
No, just the pain in my chest, doctor. And
Chest. Okay. What is the site exactly of the chest pain?
all my chest. It's a small pains around my chest.
Okay. It is dull aching or what is the character of this pain?
It's a little bit stopping. Stopping.
Stabbing pain. Does it radiate anywhere, like your left arm or anything?
No.
Okay. When you this pain, did you notice that improve by any maneuver, like hold your breathing or leaning
No, doctor.
forward? Okay.
No. Mhm.
Um okay, Mrs. Mona. Do you have any history of blood transfusion?
No.
Any shilling in Delta 2?
No, doctor.
Sorry, Miss Mona. Do you have any family history of any blood disease?
No, doctor.
Um, do you drink alcohol?
Occasionally,
How much? How much occasionally?
like only in the weekend, doctor. Not so much.
Okay. Do you smoke?
Yes, doctor.
How much cigarette and for how long?
5 cigarettes per day for
So, Mrs. Mona, it is
5 years.
advisable. Okay, so it is advisable to stop smoking because it put a risk on your health. Okay, what's your job, please?
I'm a teacher, doctor.
Is this symptoms impact in your daily activity and your work?
Yes, of course, doctor. My disease, the rheumatoid arthritis, affecting so much on my work
Okay,
because of the pain.
okay, I'm sorry for that, Ms. Mona, but I will refer you to occupational health worker. I think he will help you about this issue. Okay, Ms. Mona,
Thank you.
are you married?
Yes, doctor.
Um, how many children that you have?
I don't have.
It is intended.
Yes, doctor. No problem.
It is intended to use contraceptive pills.
Yes.
Any history of abortion, Ms. Mona?
No.
Any history of travel recently?
No.
Okay, sorry, Ms. Mona. I forgot to ask you some question. Do you have any rash on stomach exposure?
What, doctor, again?
Rash on stomach exposure? Any rash?
No, no.
Okay. Any difficult swallowing?
No, doctor.
Okay. Now, Ms. Mona, I will examine you, please.
Okay, doctor.
Okay, I will examine from the back of from the swelling.
Yes, doctor.
Okay, I will examine the swelling. It is pitting edema.
Yes, yes, spitting, doctor.
Okay. Then I will examine the back of the leg.
Yeah, but
I would.
it is painful.
It is painful. Okay, I will. I need a tab to measure the calf muscle. If it is more than 13, I
Uh,
think it is more than
I'm not
13.
sure about this. I had no information about this.
Okay.
2
Any
minutes
change in
left.
the okay? Any change in the color of the leg?
Yes, red and hot, doctor.
Okay. Okay. Then I will examine the hand for the joint. I will
Only
make a
rheumatic
look.
change. Rheumatic
Okay.
change.
I will do look and feel and move.
Yes.
Okay. Then I will examine the eye for the proximal myopathy. Is there any proximal
Yes,
myopathy?
positive. Positive.
Okay. Then I will examine the eye for any pallor.
Some pallors.
Okay. Then I will examine the mouse for any cyanosis. Then I will listen to the chest, back of the chest. Is there any basal crepitation?
No.
No basal crepitation. Okay, I will examine the chest for any pulse crepitation.
No.
Okay, I will examine the heart for any murmur.
No, doctor.
Okay, then I will examine the abdomen for any splenomegaly.
No, doctor.
No splenomegaly. Okay, Miss Mona, what's your concern, Miss Mona?
What do I have, doctor? My leg is become swollen and big and painful. Suddenly, I don't know what is the problem.
Yes, Ms. Mona, I appreciate your concern, but after taking history from you and examine you, I think I have a blood clot, blood clot in your blood channel of your leg, maybe due to your long-standing rheumatoid arthritis. So what we are going to do now, I will admit you. I will do some scanning on your in the back of the leg, and also do some blood test and scanning of the chest. And we will have another meeting after this
Okay,
result.
doctor.
Okay, thank you.
Okay, doctor. Thank you.
Okay, time's up. Examiner questions.
Okay, what's your differential diagnosis?
Today I examine Miss Mona, 34 years old, which she have leg swelling, and it has redness and hotness, and also there is back pain, back leg pain. So my first differential diagnosis will be DVT. But I also I have a second differential diagnosis will be maybe amyloidosis from rheumatoid arthritis. Apart from that, I asked about any fluoxetine, but no fluoxetine. I will admit this patient in the hospital. I have fled from pulmonary embolism because the patient has chest pain. And also she has chest infection since 1 week. So maybe not hydrated well and not mobilized. So it may be I need to exclude pulmonary embolism.
What
Also,
is the investigation you will do?
okay, first I will admit this patient. And apart from basic investigation like CBC, looking for hemoglobin and white blood cells, also I will do inflammatory tests like ESR, CRP. Also I will do EPG. For the complaint of the patient, I will do Doppler ultrasound on the back of the Doppler ultrasound on the leg. Also, I will do for the chest pain and for fear of pulmonary embolism, I will do CT pulmonary angio and the D-dimer. Also, I need and for also and I will do echo and EPG. Yes.
Okay, what could be the cause of DVT for this patient?
That's a good question. Cause of DVT. Maybe patient not mobile during infection,
Right.
bad dehydrated, not hydrated well. I think methotrexate has a cause of this case.
Rheumatoid arthritis itself.
Yes,
Okay.
rheumatoid arthritis
Okay.
itself. Yes.
Increase the vasculitis, more
Increase.
hemostasis. Okay, and also the like immobility because first from rheumatoid arthritis and also because of the infection.
Infection.
What else?
Differential diagnosis.
Mm-hmm.
As I said, maybe amyloidosis.
For the DVT.
For the DVT.
Female rheumatoid.
Yes, the patient is on photocytic pills. Yes.
And pills and what else?
Pills and maybe mixed connective tissue, but as phospholipid or lupus.
Yes. Okay. Any other differential diagnosis other than the DVT?
Maybe hypoalbuminemia from amyloidosis.
What else?
What else about DVT?
In this pain, leg pain,
Maybe trauma, but I didn't.
Famous cause. You didn't ask about
Yes,
the trauma.
Baker. Yes, I didn't ask about the trauma.
Mm.
Maybe
Mhm.
Baker cyst. Yes, Baker cyst rupture.
Yes.
Mhm.
Okay.
Yes, maybe cellulitis also.
Yes. Lymphedema. Okay.
Yes.
اوكي اوكي دكتور، مش عارفه المفروض اسال عن ايه، أنا صراحه انا
Okay.
الكيس
I-
انا باد از سيريجيتور لسه
No
بتدرب
problem.
برضه.
Did you ask about admission, Dr. Bekinam? Admission.
Yes, I
would
will
you
admit. Yes, admit this patient. Yes,
Okay. And the
for fear.
investigation.
Yes, investigation. Dr. Basim, Doppler ultrasound, and also CT for DVT, and also for fear of pulmonary embolism, I will do CT angio and the dimer.
This is radiology. I said investigation.
Yes, apart from basic investigation, CBC,
Okay.
looking for hemoglobin, ESR, inflammatory, ABG,
This is general. What about specific?
for pulmonary embolism. Yes, rheumatoid.
For this patient, specific for this patient presentation.
X-ray.
Blood test. Blood test is very important. Yes. Someone wrote it.
I have to make
Yes, no, dimer.
D-dimer. You mentioned D-dimer
D-dimer.
before?
Yes, yes, that's the best.
Okay, so
Mm.
okay. What other non-invasive test you can do or image apart from chest X-ray, CTPA?
ABG.
Okay, for X. Okay, what else? Something to the
ultrasonography for the leg.
yeah, he mentioned something else.
Yes, ECG looking for RV steering.
Perfect. Okay. Well, and ECG and together. They are together.
Echo. ECG and echo.
Exactly. Okay.
Mhm.
The last question.
For the APLS يا دكتور.
Antibodies for rheumatoid. Yes, for the cause.
What else?
Yes.
This for
What
antibody for the
antibodies?
APLS. What is the name?
What antibodies you want to screen?
Anticardiolipin for antibody.
Yeah.
And
Yes.
there is 3.
Anticardiolipin, anti-citrulated,
beta 2 glycoprotein.
Micro beta 2 glycoprotein. No, beta 2 microglobulin, not glyco, right? Or I don't know, glyco, yes.
Mhm.
I always mix. So, and anti-lopus antibodies. These are the 3. So anti-lopus, anti-cardiolipin, and beta 2 glycoprotein. Okay.
Yes, Dr. Bas.
I think time is up for the questions. Dr. Makiram, you can comment now.
I cannot comment to Dr. Lee. You comment. But Dr. Mahmoud just he was so late in the examination.
Yes,
Yes.
and
This is a
also,
comment.
I forgot about the examination.
yes,
Like,
and also I am not organized. Yes, مش كويس. أنا ما كنتش كويس النهارده.
Yes.
I am not organized.
I should ask about the performance by the person himself before I will comment.
Yes,
This
Dr.
is-
Bassem, I
Yes,
am not organized.
good to mention.
Yes, I forget many things and remember it later. So I'm not organized. I don't know why.
It's okay. I made video, Dr. Mahmoud, for how to take
Yes,
history. You
I
saw
see
it?
the video. Sure,
Okay.
Dr. Bassem.
Yeah. So try to follow the same approach. Believe me, you will not forget anything. And when you want to take system review from head to toe, do it whatever the patient is having. So you suspect here skin rash, and you can ask them with the rheumatology questions. It's okay. Okay, don't mix the question. I mean, don't ask about any rash, then headache. Start from head to toe. Then
Yes.
when you reach the area of rheumatology or musculoskeletal, ask all question you want, like skin rash and sun exposure, any muscle pain, any skin rash, any joint stiffness. Okay. Or if you want to add, you want to start it while taking history of rheumatoid, do it again as once. Don't do it, I mean, twice. Don't ask them earlier, then later on you repeat the question. Okay, let's repeat. Let's repeat the scenario. After the confirm and starting the onset course duration, you did all these things, and since you have pain, you have extra question for the pain, the scale, the site, and the radiation. Don't ask where it radiate. What does it radiate? You can say where it goes. Okay, where it goes, up or down, left or right. Don't say radiation. Okay. Then the relevant system here. What do you think the relevant system for this swelling?
That I confused because this question.
Yes. Okay.
Really?
Let's assume this is respiratory. So you'll ask about the respiratory system. If you suspect this is DVT related to something thromboembolic or thrombophilia disease, which is the case here, you can ask the question for thrombophilia earlier. What do you think in this patient, for example, any history of blood clot? Particularly, you can ask this question directly. No need to ask tricky question. Why? Because it's you suspected DVT. You can ask earlier also about travel history. Why? You want to know this is DVT or something else. So try
Dr.
to
Basu. So
roll it.
after
Yeah,
yes, after analysis of the pain, go to
yeah.
the package of thrombophilia. Yes.
Yes. Particularly if you suspect this is DVT. Okay. Then the past medical history. Now, if she mentioned the past medical history, you have to analyze the rheumatoid. How is your rheumatoid as a disease? Is it controlled or not? Yes, it is controlled. So no need to ask more. If you want to ask, you can ask about the medication. What you are on for the rheumatoid? I am on this medication. As you ask question, did you add any medication? Are you compliant? Or did you change the dose? Any previous admission? Any previous surgery? Any allergy to any medication? And the past medical history of chest infection. She told you, I had chest infection, but you didn't analyze. Later on, you ask her, you have any
Yes.
past history of chest infection? She already told you about it. So you can ask her, tell me about about the chest infection you had recently. Doctor, I have been admitted for chest infection. I receive may I know the name of the antibiotics? Is it controlled? How many days you stayed in the hospital? Are you ambulatory that time, or you stayed longer time sleeping or immobile? This question makes sense that this patient have a trigger of DVT because of immobility. You can say this is at the end as a differential on the top without any hesitance. Why? Because already you have the trigger provoked by immobility, and she has antiphospholipid. Later on, you discover that she has miscarriage, for example, but it wasn't the case here. But don't ask her about the pregnancy and the pregnancy. You told her, is it intended? Rather than you can ask, do you have any miscarriage? It's not our concern that she is intended not to be pregnant or not. But if
Yes.
we can ask another question, we can ask, do you receive any birth control pills, or you have any miscarriage before? This question makes sense for us, right? Rather than asking here, are you intended not to be pregnant? I don't think it's this question makes sense, right? Okay, let's
Dr. Basu.
yeah. The system again. We will go back to the system view. You start from the headache, eye vision problem. Also, you can ask because this patient is rheumatoid arthritis. She might
Doctor,
have. Yes,
sorry,
yes.
when he asked about the pills, is he tell me that I have to stop the pills?
No.
Yes, it's important here
I
to
didn't.
stop.
Yes,
Yeah, to
yes,
stop and
this is the
to give
point.
him her advice about the alternative option. What's the alternative option here? We'll refer you to the woman doctor. But birth control pills as a medication, as a pharmacological option here, is unsafe or are unsafe. Why? It's a thrombophilic medication or it's thrombophilic agent in your condition. And I can put it in the differential, by the way. It's one of the differential provoked by OCPs. This DVT, I mean. Okay. Okay. Then let's go back to the question of rheumatoid. We mentioned the medication and the stiffness. You can ask about the stiffness because this is the most important question. Give you a clue if this patient rheumatoid controlled or not. The stiffness itself. So if she has stiffness for longer than 1 hour, still she needs to be more controlled. And the medication history already we finished. Medication list. The system review, as I said, from head to toe. The headache, the vision, the eye, redness of the eye, and the mouth sores. If you want to put the sun exposed rash in the face as CNS in the face, I mean, you can ask, or you can put it with the skin rash at the end. The neck for any whether tolerance or preferences. The chest here, you have to ask more question about chest and cardiovascular. Why? You suspect DVT, and the DVT, most of the DVTs could be complicated by pulmonary embolism. I think also this patient is having pulmonary embolism. How to ask? Chest pain, awareness of heartbeat. If there is any positive, you can analyze, as you did exactly. The awareness, is it regular or irregular? The chest pain, what exactly the nature of this chest pain, how much the scale, is it, what makes, I wrote this question down. What makes it better and what makes it worse? Don't give example unless she asks you, what do you mean, doctor? How? But don't tell her, don't assume that this pain will be increased by breathing or inspiration. You don't know the nature, right? My point is, don't judge on the pain itself. Don't say this is inspiratory pain which works with the cough. No, I don't know. So the best question, what makes it better? What makes it worse? If she asks you, what do you mean, doctor, by this? You can give her example. The position, is the position make it better? The breathing make it better or worse? Okay. So don't give a clue or don't give the hint that you know the case. You are asking, but you are not assuming this is the case, because it might be another thing, chest pain for ischemic heart disease. Yes, mostly it's PE, but ask the question, what makes it better and what makes it worse? The short of breath, of course, the coughing of blood should be here also, because this is expected to be pulmonary embolism with cough of blood, hemoptysis. The abdomen, I think you can ask only for discomfort, any change of bowel habit for Felty syndrome and splenomegaly in the rheumatoid, or you can do it in the examination. Then the female history, particularly the miscarriage. We are always asking about pregnancy, period, and pills. In this condition, instead of asking about pregnancy, I will ask about the pills, the missed pregnancy. Why? Because here is important to know if this patient is having anti-fluid antibody syndrome or antibodies. Okay. If she told you, yes, I have, you can ask about how many times and what action you took. Any medication you took for this or no. And then the musculoskeletal, it's important here. Any skin rash, any joint pain, any joint stiffness, if you didn't ask earlier, any muscle pain. It's important to ask about muscle pain. If you want to add the other question for mixed connective tissue, you can add here in the rheumatological question. What are they? Muscle pain, one of them I mentioned for polymyositis. And what else, Dr. Mahmoud, for mixed connective tissue? What do you think?
Yes, rheumatoid arthritis, systemic lupus, antiphospholipid,
Perfect.
and also Sjogren's syndrome.
Dryness, dryness in the
dryness
eye,
in the
dryness in
eye.
the mouth. Okay.
Yes, and also dermatomyositis, rash on
Muscle pain. The
muscle pain.
muscle
Yes,
pain. Yes.
yes, polymyositis. Yes.
The same polymyositis, muscle pain, or what's missed? There is secondary
Yes, there is
phenomenon.
secondary. Yes, hand pain, hand pain.
Hand pain or Raynaud, hand pain for
Raynaud.
Raynaud, for Raynaud.
syndrome.
Yeah,
Yes.
it might be also there. Difficult swallowing for Jigren also, or systemic
Jigren.
sclerosis,
And
systemic sclerosis, any skin tightness. You can ask this question just to rule out or to rule in this is mixed connective tissue disease with the musculoskeletal or rheumatological question. Or you can ask them earlier if you have a history or positive history about rheumatoid arthritis. So you can ask all this question earlier when you talk history of rheumatoid arthritis, so you can confirm or rule out or rule in any mixed connective tissue disease association. Okay. Then the travel, if you didn't ask earlier about travel as a thrombophilic condition, you can ask it here. Don't miss the urinary system. I didn't mention the urinary system. Here also you can ask for PNH, paroxysmal nocturnal hemoglobinuria. This one of the thrombotic disease. And family, or you have to ask about family history, any family history of same condition or blood clot. Some of the conditions running in family like PNH, you can ask direct any family history of blood clot. We forget trauma, Dr. Mahmoud. Also here you can ask.
Yes, I forgot trauma.
Yes, trauma, one of the common questions, especially if you put Becker cyst or ruptured Becker cyst as a differential. Then the occupational, the question and the job, the impact on the job, and the examination. I guess you finish late, that's why you don't have good time to do examination. But the examination step, as you started with the hand, look, feel, move quickly, at least one test for every. So look for deformity and feel for warmness and move for correction of the deformity. Do one test even, just pick up the coin if you don't have time, of course. But if you have time, you can do most of the tests. Dermatomyositis, so you can do for proximal myopathy. It's a skin tightness, also you can do it. Then the eye for any redness, rheumatoid arthritis as scleritis or episcleritis, mouth sores as association. Now the chest is important to examine for decreased air entry or any change of the auscultation, wheezes or rhonchi, or crackles. Crackles here is important. If you have crackles, ask the patient to cough, as interstitial lung disease complicated by, or rheumatoid arthritis complicated by interstitial lung disease. I don't think there will be murmur unless there is right side pulmonary hypertension due to massive PE. So you can suspect tricuspid regage, right?
Yes,
Yes. Or pulmonary hypertension as loud B2 or parasternal heave. The abdomen, if you have time, or you can offer just for splenomegaly. Why? For Felty syndrome. And it's important to examine the legs. What test you can do for the legs?
Tape measure by that.
Yes, perfect. This is at least you can do this one, and doing some touching, also like look, feel, and move. Look for any redness, feel for any warmness, and move, ask passively and actively movement, and check for any change of the sensation if there is change of the sensation. But I don't think there is a change of sensation, and the tenderness here maybe limited the movement. You can examine the back of the knee for a ruptured Becker cyst. The popliteal fossa. Of course, to do this case as a complicated and complex one, you have to have good time in the examination, at least maybe 4 minutes. So try to finish this case history at the minute 8 or 9 maximum. Then you will do examination from 9 to 14 or 13. Then the concern at the end, admission is very important. Of course, she will be admitted because of the DVT. She might or she will need anticoagulant. For how long the anticoagulant, Dr. Mahmoud, this patient?
It is provoked, so it will be 6 months.
Provoked 6 months. Are you sure?
I think
Provoked. You said provoked.
it is provoked, yes.
So provoked how many months?
6, I think.
The opposite. If you have a reason, so the duration will be less. But if you don't have reason, the duration will be longer, right?
Yes, longer, yes.
So here what?
I think autobasm unprovoked it is for 2 years and provoked 6 months. I didn't remember it.
No, provoked for 3 months,
Yes,
unprovoked 6
3
months.
months. No.
Okay, in such patients, she had
Unprovoked for life, provoked for 6 months.
If it is recurrent, I think.
the recurrent, Dr. Aish.
Mhm.
First
If they
time,
confirm there is something like antiphosphate or something
yeah,
like
that's why I'm going to, yes, I'm going
Yeah.
to discuss this point. If you have such patient with DVT or recurrent DVT, it would be, Dr. Mahmoud,
If again, sorry, vessel, if
such patient with the
Yes.
second DVT or second PE,
yes,
how long the medication will be received, anticoagulant?
for life.
Yes, lifelong. Perfect. But Dr. Aisha, for any provoked, even a positive DVT here, sorry, positive antibodies, supposed to be 3 months, right?
It is 3 to 6, but 6 is
6
thing
for
they use
unprovoked.
because now the first line is the oral new oral anticoagulant
Yes.
in this
But
condition.
antiphospholipid, no, but antiphospholipid is contraindicated
Yes,
for.
it is something other, but the first line now for provoked DVT or pulmonary
Yes,
embolism
you're right. Yes,
is
you're right.
new oral anticoagulant.
Yes.
There is other thing you mentioned here about contraception pills. Really, in this case, I read about it more because I'm confused also about it. We should not ask the patient to stop the oral contraceptive in this case because multiple things. Okay.
Yes,
The
but
first thing,
okay,
it is
continue.
not. Yeah, it is not something genetic that will interfere with the contraception. There is some contraindication of contraception we know. Okay, and this patient already have the DVT and or the BE, and she will be on for 6 months on a new oral anticoagulant as a first line, or maybe other things, but this first line. And all oral and new anticoagulant is harmful for any pregnancy. So we should make sure that this patient will not be pregnant at that time. So they prefer not to stop the oral anticoagulant, and they said that on trials it's no difference that the recurrence because she already will be on anticoagulant, so she will not be at risk at that time to be have more clot or like that. She will receive already anticoagulant for months. The other point that they said that if we stop the contraception, the patients will have like maybe menorrhagia, maybe something like that, and it will be more with starting the new
Yes,
the oral
anticoagulant.
anticoagulant. She will bleed more with this starting, and they fear from that.
Okay.
That people prone to bleeding. So they advise, at contrast, they advise to use anticoagulant if no contraindication for the patient, like no any contraindication like antiphospholipid, like patient have migraines, like all the contraindication. But they prefer really in provoked DVT or BE to the female receive oral contraceptive pills.
Perfect. Okay, let's think again. If you face this question in the exam and you don't know what exactly you can say, so what the best answer, Dr. Aisha? For me, I will do it. If someone will ask me, what do you think? Will you continue?
I
Will
just
you?
will not mention something for her because she
Well,
will
okay.
not ask you.
Yes, but it's something maybe trigger if you don't have another reason, for example.
Oh,
But the
yes,
best
yes. If you
answer,
have not
yes,
other reason, if you have another reason, you should consider that this is an
consider.
issue.
Perfect. Okay, if I have or I don't have, and this is
And this is well
the
called unprovoked. So you will make this patient, she is prone to clot. You should stop the COP.
okay, you should stop. Okay, let's talk about this case again. And I'm not sure is it related or not, and I am in doubt. What shall I do to be safe? And in the same time, I didn't stop it. So I can
Okay,
say,
yes, we can say that we will include the,
exactly, I will
yeah.
hold and I will include the woman doctor to give her the best option, either to continue or to stop it or to change it. This is her decision. Regardless the information, because I am not aware about it. This is what I mean.
And I
Yes,
think
you're
this is
right.
not the woman doctor here. If we need to change, it's a woman. Now it is the blood doctor, like that. They will
Okay,
decide.
so
Yes,
multidisciplinary team again. So they will
maybe.
sit
Yes,
and
yes.
they will
Yes, you are
decide
right.
the best option for her. Yeah,
Mm.
but be sure that don't give clear cut for the answer that I will stop or I will continue. Let's hold it till taking another opinion. Okay.
Because I think Dr.
Yes.
Bassem, it may be the cause of the
Yes, I
patient.
agree to hold it.
Yes.
Even if I will not stop it totally, I can hold it.
After finishing the oral, the anticoagulant, we can consider that this advice.
Because
But
Dr.
at this
Aisha,
time,
the examiner, will not know this information,
Yeah.
really. He will talk
Yeah.
to you at once.
yeah.
Yes. Exactly. Yes, I
But he
agree.
can ask
He,
you why you stop the contraception for this patient.
That's
She
why
will
I will
bleed,
hold
or
it.
or this
Yeah.
is will
I
be
hope,
teratogenic. This oral anticoagulant will be teratogenic for the baby.
yes,
Uh,
as Dr. Bassem, be diplomatic.
Yes,
We
diplomatic,
hold.
really. Yeah.
Yes.
Hold it and wait for the another opinion. This is first thing. The second thing, the examiner will not reach to this detailed
Yes, will
question.
not reach. Yes.
Yeah, investigation, admission, differential, what's your case, the management plan, and never he will reach to the diagram to start or to stop or to hold what the anticoagulant. He might ask you for how long and what the option, maybe the time will be up. This is my opinion also. But at least to know the provoked will be for 3 months, unprovoked for 6 months, the recurrent lifelong.
Yes, and
Okay?
I think this is enough, Dr. Bassem. The examiner
More than enough.
will
It's
know this
5 times.
information only. Yes.
Yes, exactly. It's more than enough. Okay. Of course, the examiner question, Dr. Bakinam did it all question, I think, and I asked some question also for the admission, for the management plan. Don't forget, Dr. Mahmoud, to start with general, specific bedside imaging and invasive tests. By this way, you will not forget any of them. But if you start with chest X-ray, DVT, ultrasound Doppler, what about D-dimer? Will you do ultrasound Doppler without requesting D-dimer?
No,
Does that make
no,
sense?
no.
So
Really
please,
no.
yeah, arrange your
Yes.
answers in this way or this approach. I will start by non-invasive, sorry,
but
by
really,
basic,
in high suspicions, they start by ultrasound. This is the guideline.
but
Sorry.
believe me, they will
Without the
do.
D-dimer, because the D-dimer is misleading. If you have less suspicion, you will start with D-dimer to make more suspicion. But if you have high suspicions, you can start with HRCT, really, if you have high suspicion. But they prefer Doppler
You mean
first line.
CT pulmonary angio?
Yes.
Okay, let's have.
Yes, yes, CT angio.
Yeah. Okay, let's go
But
back to the question again. Yes,
I think Dr. Aisha, the examiner, need to listen to
exactly.
Daimar and
This is
think.
yeah,
Really, I am sure.
yeah. Okay,
They need to listen that.
I will ask Dr. Aisha a question. What you should do before doing CT pulmonary angio?
Doppler. They making Doppler first
No.
line.
Okay,
Yes.
you did the Doppler and you
High
are about.
suspicion, in high suspicion. If there is
Okay,
something
you
in history.
okay, you have high suspicion this patient is pulmonary embolism. What you
Mm.
should do as a blood test before doing any CT angio?
Kidney
Kidney
function
function.
test.
Yeah.
Perfect. So again, we went back to the basic blood tests. you have to do the blood tests not only to be conclusive, at least to rule out something you might have, like impaired or renal function. So I could think about other tests to do rather than harming the
But I think
kidney.
they will like to hear the ultrasound Doppler for lower limb first thing, because it is obvious that there is different diameter. There is a
I will
science in
mention it,
Yes,
here.
but
sure.
Yeah.
anyway, I
For the
should
complaint.
mention it. Yeah, I should
Mhm.
mention it, but I should start as general bedside, specific bedside, and in imaging, and lastly invasive. And I prefer to do it and let him choose which zone he want to ask you. So let's imagine you mention specific tests. He will ask you, what do you mean by specifics? I will say D-dimer. Does it harm if I do the dimer? Yeah,
Just not
most
harm,
of the
but just
patients.
this is a guideline to start by Doppler,
No,
because
no,
the
no.
dimer he will not differ on you. If it is negative, it will not change anything in your plan.
No, no.
If
If
it is
negative,
positive.
في
no.
مجال السايح دي ما علينا.
No. If negative,
It
it's
is
good
good
negative.
negative.
Yes,
Yes,
good
good
negative test.
negative.
Yeah, but for
The
you,
problem
you
if
will
positive.
make ultrasound. Even you will not start wait for result of the dimer in this case, because it's suspicious.
They are doing it, believe me, in all patients. Even it will be positive most in the
Yes.
patients, but they will do it. And
Yes, you
CBC
should
also,
mention. You should
coagulation
mention,
profile.
but yes, you should mention. But the specific here is it will be ultrasound first. Yes.
Doctor Aisha, if you tell the examiner, okay, CT pulmonary angio, he will write in the feedback, didn't mention D-dimer. Believe me.
Just before Doppler for the lower limb.
Yes,
Then
first
you
for
will
complaint,
blood test, then the
yes,
CT angio. Yeah.
yes.
That's why start systematic and wait for his question, which area he want to ask you. You give him more time to ask in the investigation, and you can answer all question investigation. Even in the management, you can start in the same approach: non-pharmacological, pharmacological counseling, education about the patient, the condition, complication. And if you reach to the pharmacological, the time will be short because he will ask you the options. As you said here, we cannot give DOAC or new oral anticoagulant. So what's the option will be here? Will be warfarin or vitamin K antagonist. So in this way, at least you didn't go
Why
through
you will not give this patient the new oral?
antiphospholipid.
He is
Antiphospholipid.
positive. Yes.
She is, yes. She
He
is
is
positive.
positive. Yes.
Okay.
Hmm.
So what I mean, the systematic answer always give the examiner impression that you are a systematic doctor, and they can give you good mark.
Mhm.
Okay. By the way, I received my feedback about the long case, which I got 28 of 28 in both. I have a lot of comment. Imagine they commented, but all comments are positive. They mention what I did in the good way. Yeah, it was satisfactory, all the task. But
Mhm.
in every skill, they are commenting about positive thing. For example, one patient of lymphoma, it was DVT. I remember by this, by the way, from this scenario. Lymphoma patient or non-Hodgkin lymphoma patient, he mentioned to me that he has blood clot in his legs. What I did while doing examination, at the end of the examination, I reached to the leg. They told me 2 minutes left. I told them I will do one test. They told me, what do you want to do? I found a tape on the table, a tape. I told them I want to measure the circumference of the leg. And I did it. I did it quickly, croaky. Quickly, measure here, measure here. I say, oh, yeah, there is difference. And there was no difference, of course. Both of them are similar. But I act like there is difference. They mention in the comment that he measured by the tape the circumference of the leg as a positive comment. So everything you do, they are commenting on. This is the message I want to mention here. Anything in the history positive, please write it in your paper. I want to examine this. Like in this scenario, rheumatoid arthritis, I should examine the deformity and the hand for rheumatoid arthritis. I have DVT, I have to examine the DVT. I have possibility of PE, I have to examine the chest. What else? It would be less important to examine, but I should offer them, like Felty syndrome as a rheumatoid, like systemic sclerosis, like skin tightness, proximal myopathy. But the most important to examine the patient presentation, DVT, PE, and rheumatoid itself. Okay. So don't miss even small complaint or small positive family history, or sorry, any positive finding in the history. Put it in your paper. I want to examine this. Why? Because they are taking care of every step you are doing. Okay. Any question regarding this patient or this case or the previous case? Any discussion? Let's see the comment. I think Dr. Hatem, he sent me earlier the differential. By the way, Dr. Bakinam, it's a very common topic in the exam and very common presentation in the same differential. The same differential, DVT, ruptured Becker cyst, and cellulitis.
Yes.
The same presentation, the same differential, the same case, in the same history like this. So take care of this scenario. It might come. And don't forget the rheumatoid as rheumatoid examination.
Okay.
And Dr. Mahmoud, please, whenever patient is sick, cannot tolerate her job, give her sick leave by yourself. Don't
Yes.
refer to the commission. I wrote it not to because I always forgetting, but I wrote it just to remind myself and to remind you.
Doctor, I listened before for doctor, but I don't remember
Okay.
who is. He say we are not talking about sick leave. Don't mention sick leaves.
Okay. In my
Only occupational health worker
in
will
in
help
my
you.
Okay, I will tell you now. In the
Mhm.
lymphoma case, in my exam, I mention sick leave. I will give your uncle sick leave because he's sick. He cannot even tolerate his daily activity because his
Mhm.
concern was about, doctor, will he go back to his job? I told him, at time being, your uncle is sick and he cannot even tolerate his daily activity. So we will
Mhm.
provide him sick leave for his job. And they didn't comment about that. In another scenario, it was the patient with inflammatory bowel disease. Patient have hip replacement because of avascular necrosis due to steroid use. It was medical error. And the
Mhm.
patient asked me, or I asked him about his job. And he was annoyed because of this mistake. I provide him a sick leave. I told him, I will give you sick leave just to be resting because of your fracture or your hip replacement. And it was correct. No one comment about it, and I got the full mark. So what I mean, you are a doctor. You
Mhm.
can provide sick leave. Why not? As I
Right.
I am doctor. As I am doctor, you can put recommendation in your job, in your hospital. I mean, or any one of us in ER or IM, he can provide sick leave by himself without referring a patient to a commissioner, right? So it's safe
Yes.
to mention it.
Mhm.
And exam wise,
Okay.
I told you two example. Both of them I didn't get any minus. Okay.
Okay.
Amyloidosis, Dr. Hatem wrote amyloidosis. What put in the differential for acute lower limb swelling? I don't know why amyloidosis in acute lower limb swelling. It's not. I think it's not appropriate.
No, not written differential diagnosis. No.
Yes, cellulitis, rupture Becker, trauma,
Mhm.
and
ممكن
DVT.
lymphedema.
Lymphedema supposed to be bilateral, I think.
Mm. No,
Okay.
maybe block in one
Okay, but
pathway.
it would be non-betting. Non-betting edema.
Okay.
This is the only
Yes.
non-betting edema we know.
Mhm.
Otherwise, all other edema will be betting. So it leaves mark. Already he asked in the questions in the history, and
Yes.
he did it in the examination. It leaves mark, so it's betting. Okay, anti-lupus, anti-glycoprotein, anti-cardiolipin by Dr. Hatim also. No, iPhone. Safety netting after discharge. If it develops chest pain, bloody cough, heart racing, he can report the hospital. Is it applicable here? Safety netting at the end, I don't think you have time to give safety netting or to talk about these things. And the patient already have chest pain. Why you are assuming there is no chest pain, right, Dr. Buckingham? There is chest pain and pulmonary
Yeah,
embolism.
there is chest pain. Yes.
Yes. So he already have or she already had the chest pain. After discharge, if she developed chest pain, she had already chest pain. Dr. Nada, we can elaborate more on short of breath. Is it acute, sub, or chronic for rheumatoid related? Yes, of course. You have to know, is it interstitial lung disease or it is pulmonary embolism? Any complaint or any finding in the history, ask first question, since when? If it is since 1 day or 2 days, this is acute and related to the condition. If for long time, it could be related to the original disease, which is interstitial lung disease for rheumatoid, complicated the rheumatoid arthritis. Yes, agree 100%. You're right. Methotrexate, of course, also related. It might be related fibrosis. So you have to know when exact. The first question for any complaint, when. You always ask when. The onsets. The first thing in the element of OCD, onset, course, duration, onset, when exactly. So you will know when exactly. Is it old? Is it now? Is it recent? Is it 2 weeks? Is it 1 month, 2 months? You will know. Dr. Aish, Dr. Aish, Ala, Dr. Ala, maybe Ala. Three, I think he meant, I don't know what three it was the question about.
Anticoagulant in provoked
3 months, yes, it was
3
three,
months.
yes. Provoke 3 and provoke 6, recurrent, lifelong. Renal profile, of course, thank you. It's for the CT angio or for any contrast using imaging, you have to do CT, sorry, you have to do renal function or kidney function test. Dr. Salah, I think, yeah, as a occupational, anyway, I'm not commenting on any monitor. And what is make you or what makes you comfortable, follow. If you are comfortable with my advice, follow it and my opinion, and follow your sense as well. If you think that sick leave is okay, do it. If not, and you think it is not appropriate, don't do it. Then tell us about your feedback. But I give you 2 examples from my experience in the PACES. Sick leave can be given by us. No problem of that. Thank you, Dr. Hatem. The candidate mentioned amyloidosis as differential many times. That's why I was wondering. No, it's not differential. Amyloidosis cannot be the case here. Amyloidosis if renal function worse, or if there is carpal tunnel, if there is affection of nerves,
Yeah, and they're not
neuropathy,
acute.
not acute, no.
Mhm.
Yeah,
But Dr. Mahmoud say against that there is no fruity in the urine, not fruity urine.
yes. Believe me, system review give you a lot of clues related to the case. As Dr. Bakinam said now, the question for the urinary system here is very important. Why? I ask one question. Any frothiness in the urine? If there is positive frothiness in the urine, it would be amyloidosis. But it's not the case. I mean, but you have to put it in your mind that there is affection of her kidney function. I should know this patient might have multi-system affection. One of them, the kidney, the lungs, interstitial lung disease, the skin, the joint. I have to ask the system review because some doctors thinking that the system review, if I reach to the diagnosis and I know the case, it's not necessary to ask all questions. For me, I should ask about every system. Even one question for me is fair enough. Dr. Mona, sorry, I joined late. So do you need anything, Dr. Mona? Do you want to add any question? Yeah. You mean the safety netting? Yeah. So this is your comment, Dr. Mona Ibrahim. bloody diarrhea. Yes, I answered this before, so it's not applicable here because the patient already having PE, pulmonary embolism. Agree with you, Dr. Hatim, but candidate mentioned it many times. For me, it is not even differential, should be mentioned at all. Okay, one more advice, Dr. Muna, Dr. Bakinam, Dr. Mahmoud. Please, if you want to be very sympathetic and empathetic with the patient, do it once at the end, at the beginning, and maybe at the job. Okay, so if the patient is having pain, be sympathetic. I am sorry for your pain, and it might be, or it must be distress for you once only. Then when you ask about the job, any problem, what the impact on your job? Yes, doctor, I cannot. Oh, I'm sorry for that. I'll provide you sick leave. That's enough. Not with every question to give her, or to feel sorry for her, or to show her some sympathy.
Yes,
Okay.
you know why, Dr. Basim? I failed one station in communication because failed sympathy.
Oh my
So
God.
so I always be sympathetic now.
But it takes time really to give her
Yes,
and to
the
pay
case
attention.
was
Yeah, that's
the case.
Uh,
enough for
I
one
think
time.
because we
Yeah,
are nervous also.
and
That's why we are filling the gap with, oh, I'm sorry. Oh, I'm sorry.
no,
Because
please, Dr.
filling the
Bakinam,
gap.
you have to fill the gap with the system review questions. Don't miss any
Yes.
system. Any
Yes.
system you miss, it minus you. By the way, one of the comment I got as a positive, they wrote
Mhm.
systematic. So it's like, yeah, it's a positive thing to be systematic while taking history. They mentioned this systematic in both scenarios, so that's why I put this approach in the video. I felt like this is the most comfortable approach, and this is the most satisfactory approach in two scenario. If you got 28 in both scenario, means your history taking and the approach you did in both cases is the maximum satisfaction of the examiner. That's why I made the
Yes.
video in this approach. Do it in this approach, believe me, you will get good mark. And they commented on this. They wrote in both scenarios systematic. So the question was in this way and it was systematic. I hope you will do the same and you will get the same hopefully in your exam, inshallah, and you pass from first attempt, Dr. Bakinam, and Dr. Mahmoud in the next attempt.
Thank
Hopefully.
you, Dr. Basham. Thank you.
Most welcome, Dr. Bakinam. Any question and or comment, Dr. Bakinam or Dr. Mahmoud?
Yes, Dr. Basim,
No, thank you.
about the case of inflammatory disease and the fracture neck. It is
Yeah.
written in the scenario, it is error.
Fracture neck. Yes, it was error. No, they wrote yes as a task. Yeah, it was
I
error
because
for
steroid.
steroid mentioned, or it was prescribed by junior doctor.
Yes, doctor.
So it was even the task was medical error.
Mm.
I believe this is the best communication scenario ever to get full
Error,
mark
yes.
in medical error. You will fill the gap with your steps of apologize, admit, again apologize, and try to correct the action. You will get the full mark blindly. Other scenarios, there is some tricks. You have to give questions and to answers, uncertainty. End of life care also, I agree. Palliative, sometimes they are not clear about the task. Anyway, hope and wish to face a medical error scenario. At least you can get full mark in this scenario, and hopefully you can get in other scenarios full mark, inshallah. Any other question?
Thank you very much.
Most
Thank
welcome.
you.
Thank you, Dr. Mahmoud, for participating today, as well as Dr. Bakinam. Believe me, these opportunities give you the confidence to be more ready to your exam.
Inshallah. Thank you, doctor, for this
Most-
opportunity.
Thank you. Thank you too. Thank you, Dr. Ala. Any question from others? Comment before ending the session? Oh, 2 hours. What? Oh my God. It's Not 2 hours. We started 11:15. So about 2 hours. Okay. Any question? We can end the session now. Thank you, Dr. Mona. Best of luck, all of you, to pass this horrible exam. I know it's nightmares for some doctors, particularly Dr. Buckingham.
Yeah, this time.
Hopefully, inshallah, you can do it really.
First trial.
No worries.
Very,
No
very
worries.
easy,
Enjoy
Dr.
it.
Buckingham, really. Very easy, wallah. Very
Enjoy
easy.
it. Just enjoy it. Yes, enjoy
Yes,
it
just
I
enjoy
hope
it.
so.
and
I
feel
hope so.
relaxed. Don't be stressed, and you can do everything, inshallah.
Inshallah. Thank you, doctors.
Okay.
Thank you.
Thank you. See you tomorrow, inshallah, the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.